Well, good morning, everybody. Good morning to those of us in Western Canada. And good afternoon to our friends in the Eastern time zones. I understand in Ontario that you have big, beautiful snowflakes coming down as a winter storm blows in. And out here in Calgary, we have a Chinook wind blowing in, taking us from our deep freeze at -30 to -3 in just 24 hours. So it's migraine country. But welcome to everybody. My name is Doug Chisholm, and I'm welcoming you to our 9th National Conference. I'm chair of our National Board of Directors for the Canadian MPN Network. And we are truly a network. Last weekend, I was at the Joyce Niblack Patient-Doctor Conference in Scottsdale, Arizona. And on the Friday evening, John Clark and others welcomed the conference participants to a hospitality suite where they could hear more about how we operate in Canada. And it was really quickly clear that we are unique in our network of support groups across Canada. In every area across Canada, via either a closed MPN Facebook group, or in most cases, an in-person MPN support group, where we can provide factual, up-to-date, relevant information, as well as to journey with our MPN patients and their care partners. This network we have in Canada is a best practice. Is being emulated without exaggeration all around the world. The last weekend at the conference, I was reminded about the tremendous progress being made in our MPN journeys. I've journeyed with this chronic leukemia for 33 years now. I've seen it move from being a disease, an MPD, to being classified by the World Health Organization as an MPN, a cancer. And back then in 1990, very little was known about ET or PV or MF. But today the pipeline is full of new targeted medications. And the current understanding of our MPNs is like being on Star Trek compared to being back then. So if there ever was a time in the last 30 years to have to journey with an MPN, it's never looked as hopeful as it does today. So as well as being a network of MPN support groups across Canada, the Canadian MPN network is active in advocating in Canada for the approval and the provincial funding of many new medicines and therapies coming to treat MPNs. And while we don't yet have a non-stem cell transplant cure, we've begun to have evidence that we can indeed hope for it to happen. Our national organization is moving forward too in order to maximize the impact that we can make for your benefit. And to this end, our board of directors is planning our first strategic planning session in late May to identify priorities and to focus on the important things for our organization, and then to attach the necessary donated funds to each in order to make them happen. You know, our momentum in Canada grows every month. And we as a board continue to actively commit ourselves to bring to you, our fellow patients and care partners, our very best efforts in making your MPN journeys manageable. I think you'll be really encouraged by what you hear in our national conference today. And if you'd like more information about a Canadian MPN support group near you, or if we can journey with you in any way, please reach out to us at info@canadianmpnnetwork.ca or visit our website for more information. You know, one of the really exciting impacts in Canada has been the formation and the work of our sister organization, the Canadian MPN Research Foundation. We share with them our executive director, who I'd like to introduce to you now and pass the torch to her. I'm very pleased to ask Cheryl Petrick to tell us more about the Canadian MPN Research Foundation and about a new app for your phone or your tablet that was the talk of the conference last weekend called the MPN Genie. So over to you, Cheryl.
Thank you so much, Doug, and welcome to everyone from coast to coast to coast here in Canada. And perhaps if you're joining us from outside of Canada, we welcome you to our national conference. So I'd like to give you an update of the Canadian MPN Research Foundation on some of our 2023 projects and initiatives. One of our new initiatives is the Canadian MPN Faces. So if you're a patient or caregiver and would like to share your story with us about your MPN journey, we're compiling all of these stories to bring more awareness to MPN blood cancers. We hope that you will share with us your story, and we will be producing a digital and hopefully a print publication and video on this project to bring awareness to our blood cancers, because we know that as it's a more rarer blood cancer, a lot of folks in Canada and around the world don't know about our blood cancers, or if they see you on the street, they don't know that you are afflicted with an MPN blood cancer, because in many times you don't appear to look sick. So we want to bring awareness. We want to share the stories, your stories, in how you are traversing with this journey, and bring more awareness to our community so that more people get a better understanding of MPN blood cancers. As Doug mentioned, we have the MPN Genie app. Well, on your phone, you can go to the Google or Apple store and download, or your tablet, and download the MPN Genie. This app is a tracking app or a diary of sorts for you to be able to track your quality of life and the burden that the disease has on your life. It is available in Canada in both English and French, and we're actually globalizing the app in 2023. We will be globalizing it into the United States of America, Spain, Italy, and Germany. We'll be translating the app into those specific country languages. And it's important that later on in 2023 or early 2024, this app will be fully globalized for around the world. So MPN patients around the world will be able to use this app in qualifying their quality of life through their participation in the app, sharing their information with their physician, and most importantly, or not most importantly, but one other factor is sharing the anonymized and aggregated data with our research community that will help our researchers utilize this data in perhaps developing new and ongoing treatments that really will be there to help you navigate your journey and live a better quality of life. A third project that the Canadian MPN Research Foundation is looking at, or actually initializing for 2023, will be the development of an MPN AI algorithm. So the Canadian MPN Research Foundation, along with Cure Health, are developing an AI algorithm to help our physician community help them better diagnose MPN blood cancers, and to assist them in understanding and identifying progression as it may occur for some patients. So this project is in its infancy stages, so stay tuned for more to come on this exciting project. And we just think that AI is actually coming to fruition in many aspects of our medical community, and think that we're at the forefront of this scientific knowledge. So we're very, very excited on this. So at this point, we'd like to now introduce Dr. Angela Fleischman, who is one of our keynote speakers today. She is the Associate Professor in the Division of Hematology and Oncology Medicine at the University of California, Irvine. Her research interests are in myeloproliferative neoplasm, hematologic malignancies, and hematopoiesis. Dr. Fleischman tells us that her overarching research goal is to identify what drives disease initiation in myeloproliferative neoplasms, which is a chronic leukemia, and to use this knowledge to develop therapy to prevent or treat this disease. MPNs are characterized by the somatic acquisition of a mutation in either the JAK2 or calreticulin in a hemopoietic stem cell. There is a critical need for novel therapeutic targets in MPNs. Bone marrow transplantation is the only therapy that alters the natural history of the disease, but the majority of patients with MPNs are not candidates for this procedure due to age and their comorbidities. Understanding the fundamental mechanisms by which the neoplastic clone is first established in MPN patients is necessary to develop therapeutics with curative intent. She tells us that they've developed a model in MPN whereby inflammatory insult upon vulnerable hemopoietic stem cell pools drive the emergence of clones, which have mutated in such ways to avoid the suppressive or apotic cues. MPN represents an excellent model disease in which to study the fundamental mechanisms of I can never say this word. I practiced it all morning. Leukomogenesis. We'll skip that word because it's defined as a genetic, it's defined genetic lesions, chronic natures of the disease, and the ability to quantitatively measure the neoplastic clone over time. We hope that the work that they do will lead to a direct benefit for MPN patients and will also lead to new therapies for other hematologic malignancies. Dr. Fleischman has authored and co-authored many publications, and we're so thankful that she is here today to speak with you on her topic. So thank you very much, Dr. Fleischman, for attending today. And we're very, very fortunate to have you share some time out of your day with us. And I turn it over to you.
Well, thank you very much. That was really a very nice, you made me sound very, very nice. So thank you very much, Cheryl. And also, I really enjoyed hearing about this, you talking about the MPN Genie and the AI. I think those both things are going to be really, really exciting and will be a benefit to both MPN patients as well as help physicians better care for MPN patients. So I thank you for telling us about that. I'm really, really excited about that. So my name's Angela Fleischman. I'm what's called a physician scientist, meaning that I see patients in the clinic. Basically, I only see patients with MPN, and then I see patients 1 day per week, and then the rest of my week I spend in the lab trying to figure out why MPN occurs in some people, in particular, looking at the role of inflammation in MPN, why it runs in families, and for the purpose of if we could understand why some people get MPN, what drives MPN, then we could better identify treatments or potential preventative measures so people don't get MPN in the first place. And so today I'm going to be talking about nutrition in MPN, focusing on two clinical trials that we've done in Southern California, with a caveat just so that to be clear, that our clinical trials were feasibility clinical trials to establish that MPN patients are a great patient population for dietary studies. And so my purpose here is not to give you specific things to eat, but to introduce general good nutrition in myeloproliferative neoplasms and open up the door for further research to identify then specific dietary patterns that would be beneficial in MPN. So from my perspective, MPN is a chronic inflammatory condition. It is currently classified as a cancer after in 2005 when the JAK2 mutation was identified. Prior to that, it was not a cancer. It was designated as a benign blood disorder. But because the word cancer means you have some cells that have a mutation and those expand, then MPN sort of classically fit into that criteria. Interestingly, subsequently, now we know that a very normal phenomenon of aging is to develop mutant cells in your blood and have those expand, including JAK2. MPNs, from my perspective, really are more of a chronic inflammatory condition rather than a cancer, because we do now know that about 20 to 30% of people over the age of 50 will have mutant cells in their blood. And those people have a higher risk of cardiovascular disease, of inflammation. So it really is an inflammatory disorder. And I think that we really need to approach it as such. So here's inflammation has a big impact in MPN. You know, we talk about inflammation. Well, what does that really mean? In our bodies, we make what's called inflammatory cytokines or inflammatory proteins that have some positive impacts in terms of helping us fight infection. We have an infection, we need to fight it, so we need to increase our inflammatory cytokines. But when those cytokines or inflammatory proteins stick around when they're no longer needed, or our bodies produce them when we really don't have an infection that we need to fight, then it can cause some problems, and chronic inflammatory conditions can cause a lot of the symptoms that are observed in MPN, like itching, fatigue. So although not all of the symptoms associated with MPN, we really can blame on cytokines. A lot of them we can, implicate cytokines in those symptoms. And interestingly, JAK inhibitors, I'm not sure how many of you are on JAK inhibitors like ruxolitinib or fedratinib or pacritinib. Although those are JAK inhibitors, and many MPN patients have JAK mutations, so you may think that it's trying to target your specific JAK mutant cells. JAK inhibitors are actually also used for autoimmune diseases because they're potent anti-inflammatory medications. So maybe a different sort of mindset of JAK inhibitors, could be that their utilization in myeloproliferative neoplasms is to reduce inflammation, not necessarily to target the JAK2 mutant cells, because we know that they don't actually get rid of, in any way, shape, they do not get rid of the JAK2 mutant cells. Just to make that clear. And this is my attempt to try to conceptualize my view on the role of inflammation in myeloproliferative neoplasms, as well as other mutations that people with myeloproliferative neoplasms or other blood conditions can have. So with chronic, we know that exposure to chronic inflammation, so what's called exhausts normal blood stem cells. So over time, they can basically poop out. And that's why many times as people age, their blood counts may go down. They may get anemia because their blood stem cells are sort of getting tired and just sort of losing the umph and sort of just going away. And so one could envision that if you had a stem cell in there that had a mutation that made it resistant to chronic inflammation, that over time, as the person is aging, their normal stem cells will be pooping out, but yet then those mutant cells will be sticking around because they're resistant. So over time, you would expect those resistant cells that have the mutation to expand as your normal ones are sort of going away. And a very interesting feature of mutant cells such as JAK2, also this has been established with other common mutations that some MPN patients have in addition to their JAK2 or their pyrreticulin, such as TET2 or DNMT3A, that those cells themselves cause more inflammation. And that sort of then fuels the fire for those mutant cells to further expand. So this slide the point is to demonstrate that inflammation, chronic inflammation, likely predates myeloproliferative neoplasm. That's probably why many people with MPN also have autoimmune diseases or autoimmune diseases run in their families. Part of my lab is trying to understand whether a little bit of a sort of overactive immune system may underlie the familial predisposition to acquire MPN. But also the mutant cells themselves cause additional inflammation. So inflammation probably exists before as well as a consequence of the disease. So when thinking about ways to reduce inflammation, we wanted to think of low risk approaches that would be low cost and also importantly could empower the patient to really take an active role in their health. And so we thought diet is a great way to do this. And when you think about diet, you know, a lot of times people think when I talk about diet, this is what I'm talking about, that you can eat whatever you want, and then you just add on a medicinal sort of mushroom or something, some other healthful type of food to sort of negate out all of the other bad eating habits. This is not necessarily what I'm talking about. Obviously, we'd all love to just eat whatever we want and then just add something on. But realistically, a much more impactful approach is to have a general good diet. So I want to emphasize, it's likely as important what you don't eat than what you do eat. It's not specific foods, but having a general healthful diet that is focusing on specific sort of food groups. And that's why I think that a Mediterranean diet eating pattern is a good way for people to conceptualize and follow a real healthful eating style. And this is, again, just what I'm saying, that, you know, a lot of times we want these bad diets that, you know, may say that you're going to get, you know, great healthful benefits, lose weight. But the problem is, if it's not, from my perspective, if it's not something that one can change their lifestyle long-term, it really is just going to be a yo-yo effect and really not going to lead to long-term health benefits, but instead focusing on more of an eating pattern rather than a specific diet, I think leads to more long-term changes in one's lifestyle that could lead to better general health. So why the Mediterranean diet? So there is quite a bit of evidence for the benefits of a Mediterranean diet. In this study, they looked at 22,000 Greek participants, and they quantified how, quote, Mediterranean diet they were eating on a score of 0 to 9, just naturally, what they were eating naturally. And the people who had a higher score, meaning they were eating more adherent to a Mediterranean diet, were observed to have longer lives and better outcomes. And in this study, this was an extremely large study that was focused in Spain on looking at the role of a Mediterranean diet, specifically in cardiovascular outcomes. And in this study, they gave, to try to emphasize a Mediterranean diet, they gave one group olive oil, one group nuts, and then a control diet. So they found, so on the right, the death from cardiovascular causes was reduced in both the Mediterranean diet, where they gave people free nuts, as well as the Mediterranean diet where they gave people free extra virgin olive oil. So this, I think this has significant relevance to myeloproliferative neoplasms, because one of the major issues in myeloproliferative neoplasms are blood clots, and specifically cardiovascular disease. So I think an MPN patient population has specific relevance to MPNs. Sorry, I'm just trying to read a chat here. Okay, and I'll address a question here about that. Said that your lifestyle, including diet, may be as important or more important than medications. Should we be trying to reduce our medications as we increase our lifestyle / diet choices? I don't want to try to say that diet should replace medications. I think I think it's more appropriate to say that diet should be sort of a standard, sort of the base of any diet, and good lifestyle should be the base of any MPN patient treatment. On our, I'm sure in Canada you have different or similar guidelines. We have in the US these National Comprehensive Cancer Center Network guidelines for each cancer with algorithms for suggested treatments for each stage of each disease. And for MPNs, the first bullet point on every single, whatever category of MPN it is, the first bullet point is reduce cardiovascular risk factors. So that should really be the base of any, really, I guess any human should, work to reduce their cholesterol, make sure that they're a good weight, eat healthy, and make sure that their blood pressure is under good control. What I want to emphasize is that taking care of your general health and your cardiovascular health should be sort of the base of any MPN patient and number one, and then, but not necessarily to replace other medications. Many times younger MPN patients can be managed with aspirin alone. So I mean, in some cases, it's really not that they need a medication anyway. So I don't want to say that you can replace medications with diet, but the diet should be an integral part of every MPN patient's treatment. Okay. And so what is a Mediterranean diet? So Mediterranean diet, really, it's more of an eating pattern than a quote diet. It focuses on whole plant foods and healthy fats. And you can incorporate foods from any culture. So that's why I also think that it's a good sort of base to think about ideal eating patterns, because you can really adapt it to whatever your cultural eating preferences are. Really basically, this is the central concepts: less red meats, sweets, processed foods, eat in moderation, lean proteins such as fish and dairy. And also it does incorporate, if somebody does enjoy alcohol, for them to focus on red wines. Not necessarily, if you don't drink to begin with, don't start drinking, but the wine, it does encourage some red wine as the form of alcohol. And then lots of fresh fruits, greens, vegetables, whole grains. Now, one issue that may come up with the leafy greens and that are rich in iron is particular for a PV patient who may be trying to limit their amount of iron. I think everything is a pro and con. From my perspective, I don't think PV patients should totally limit their intake of these really healthful green leafy vegetables, but maybe be a little bit more cognizant of not overdoing it. And also incorporated it's more of a lifestyle, so incorporates activity, exercise, enjoying meals with friends and family. So really making eating a way that you can engage and interact with other people. And then here is just the eating pattern guidelines: lots of fruits, beans, whole grains, and fish. And then a key concept is giving good oils. So things like olive oils are really, I think, a good way to start is just replacing things like your unhealthful oils like butter with olive oil. I mean, if that's, I think even starting with something like that is a great approach. Or if you eat red meat, maybe switch it out for salmon one night per week. It's very difficult to make changes all at once, but to make changes in a stepwise pattern, I think is probably a more meaningful approach that could lead to long-term changes. So then this is, I in the past few slides, I was just talking about the benefits of Mediterranean diet, that really it's sort of common sense that eating well will make people feel better. But we wanted to know whether diet can specifically impact patients with myeloproliferative neoplasms. And in order to really demonstrate that, one does need to do very structured clinical trials. And before embarking on a very large clinical trial, to really specifically test whether diet can change specific things in MPN, like symptoms or blood counts, we needed to establish the feasibility of actually doing diet studies in MPN patients. You may think that these are very small steps, but they're important steps, or I guess fundamental steps that need to be done in clinical trials, because you do not want to do a huge clinical trial and then realize that you made a critical mistake in the way that you set up the trial, such that your information that you're gathering is totally useless. So that's why things move quite slow, but they move slow for a purpose, such that then on the next step, you're making sure you're making all the right decisions to set up your clinical trial in the best way possible. So we've done two clinical trials thus far. The first one was our initial pilot clinical trial, which was done with in-person dietitian counseling. We took 28 people with MPN in the Southern California area. We split them into two groups, either a Mediterranean diet group or just the standard, what's called US guidelines for Americans. I'm sure you have something similar in Canada. It's really not a very good diet. What the US recommends people to, it's very standard. And so we sort of consider that like not really a diet, but we wanted to give people in that group dietitian counseling. And those people got in-person dietitian counseling. They also got curriculum. We sent people colorful PDFs every week with just little pieces of information about either the Mediterranean or just a standard with the USDA diet. We just gave them just sort of general diet information. We also collected, although the study was quite small, so we were not expecting to see any changes in blood counts, the CMP, that's like your kidneys and electrolytes and liver, high sensitivity CRP, which is something that can be measured as a surrogate for inflammation, plasma cytokines, as well as we looked at the gut microbiome. And then our next study was we called it E-intervention. So that was basically all online. And in this one, we compared the Mediterranean versus a DASH diet, which is sort of a low salt diet that's meant for people with high blood pressure. And then with this, we did Zoom dietitian counseling. And because everybody was remote, we really had limited ability to collect biological samples. So this was our initial pilot phase. We observed people for 2 weeks, just wanting to see what they were doing. Naturally, we collected symptom surveys, MPN SAFs. I'm sure some of you are familiar with these 10-point MPN symptom surveys. We also took blood. We quantified the Mediterranean diet score with 2 different ways. One was a 16-point questionnaire asking about things like how much olive oil they ate, fruits, vegetables, processed foods, and then they got a score, and a higher score is better. And then we also performed these 24-hour diet recalls, which are quite tedious and really capture every single thing that the person ate in the past 24 hours. And then also got a blood and a stool sample. And so then the people got an active, what we call the active intervention phase for 10 weeks, where they continue to do surveys. We continue to get their blood and their stool, and then they saw the dietitian. And then we also gave them olive oil or a grocery card, depending on what group they were in. And then we wanted to continue to observe them after we stopped giving them the active intervention, basically to see, are people going to keep on their Mediterranean diet even after they stop seeing the dietitian and stop getting written curriculum, or are they just going to say, forget about it and go back to their old ways? And so just to emphasize, the main point of the study was to see whether MPN patients can change their diet with dietitian counseling and curriculum. And the way we quantified this is we said, we want we said that a Mediterranean diet score, or called the MEDOS, of 8 is good. That means that they're very adherent to a Mediterranean diet. So our goal was to have a preset goal was we wanted to have at least 80% of the people on the Mediterranean diet group achieving this MEDOS score of 8 throughout the entire course, which is the orange course, which is the active intervention. And as you can see, the pink squares are all above 80 for the orange period. They did drop down a little bit in the post-treatment time, but in comparison to the black, which is just the standard US diet, at no time did any 80% of those people have a good adherence. And this is symptom burden. So many times symptom burden in MPN trials are displayed as what's called waterfall plots, where each bar is a person. And again, we collected symptom data, but our numbers were not sufficient to really do any statistics on this. And so, as you can see, the pink bars with Mediterranean diet group, it appears that more of them had a reduction in the symptom burden. However, both diets, some people did have a nice reduction in their symptom burden, which makes sense that if you're eating better, if you're seeing a dietitian, maybe you're eating a little bit better in general, and you may be feeling better. Other things that we measured, which I'm not going to go into because we really didn't see any significant changes: blood counts, cholesterol, high sensitivity CRP, and gut microbiome. The inflammatory proteins in the blood. Again, we had too small of a number to really statistically be able to detect any changes. But as you can see, just to visually emphasize, these are the levels of different inflammatory proteins in people's blood over time. And you can see, many times, most of them are stable, but there are some people who their cytokines go up and down throughout the course of the study. And then this is our second diet study, where basically the same thing, but online rather than in person. So we observed patients for 2 weeks, and then they got an active intervention through Zoom counseling or Zoom dietitian counseling. And all of the surveys were done online. And what we wanted to test here is we thought, well, maybe if people aren't in person, they may have less of an incentive to continue to do the surveys. Will they really stick with an online study, or will they just sort of forget about it after a few weeks and say they don't want to participate anymore? So that was our main question here: is can we do clinical trials in MPN patients without ever physically seeing them? And I guess, as you know, MPN patients are extremely dedicated, and it was quite amazing that we had very excellent adherence to completing surveys, and the MPN patients did a great job. So with this, the patients were given, they basically had to fill out a daily MPN symptom burden. We sent them either just an email with a link or a text. But as you can see, this was for 16 weeks, so daily for 16 weeks. And many of them had 100% compliance. Basically, I couldn't fill out a survey for 16 weeks daily. There's no way I would be able to do 100%. But many of these MPN patients were remarkably able to, they filled these in every single day. In particular, the Mediterranean diet group, the DASH diet group had a little bit of a less compliance. This may be reading into it too much, but maybe they were a little less engaged, and so had less of an incentive to be doing these daily surveys. But the Mediterranean diet group was very good at filling out these daily surveys. And then here's the symptom burden reduction. And here's the blue is the Mediterranean, the orange is the dash. And again, both groups did have a reduction in their symptom burden, but want to emphasize we didn't have enough patients to really make any statistical claims on this. This is simply observing. And then also these are additional surveys. So this MEDOS, they were reasonably good at doing the MEDOS, which is a 16-point survey. The ASA, which I mentioned, was quite tedious and takes at least a half an hour to complete. Less so for subsequent studies, we're going to do it by phone because just expecting people to do this tedious survey online is a little bit too much to ask. And then we had pretty much 100% show rate with the dietitian visit. So really very small numbers of no-shows. And so our next steps here, we'd like to develop a much larger study, which will utilize an online curriculum. So with our first studies, we gave them a little bit of written curriculum, but for our larger studies, we'd like to make it more of a sort of a course where there's different units and patients can have, it would sort of be a course. So you would have lectures, you'd have some written materials you can look at. Then we would have some, like, I don't say tests, but little quizzes to test your knowledge of what you've learned, group classes, and then one-on-one. So really a multi-pronged intervention where you have you're getting passive information. You're also doing, interactions with other MPN patients through group lessons, and then one-on-one dietitian counseling that you can really talk about your specific situation and how you'd like to change your diet. So that is upcoming. We need to, clinical trials are quite expensive to perform. So we're working to get grant funding from the NIH, the National Institutes of Health. So acknowledgements. So wanted to acknowledge for the first study, it was primarily done by a graduate student who had Laura Mendez, who has received her MD in Mexico and then came to California for her PhD and now is back in Mexico and developing a PhD program at her home school. The second study was primarily driven by an epidemiology grad student who's also a registered dietitian, Jerry Lee, and was in collaboration with other professors at UC Irvine, as well as the initial plans for developing a diet study were developed with the help of Ruben Mesa and Robin Sherber. So thank you very much.
So we have a couple of questions that have come up, Dr. Fleischman. The first one comes from one of our attendees, and they're asking, what is oral mucosal transducate?
Oh, okay. So I did not mention that. I sort of glossed over that. So with for the second study, because the people were remote, we wanted to find some way we couldn't draw their blood. So we wanted to have some sort of a surrogate for their plasma, which is when you get your blood and I don't know if you ever realize when it sits, there's like this yellowish stuff on top, that's the plasma. So we wanted to find something that could be a surrogate for that. So the oral mucosal transudate is, it's called like an ultrafiltrate plasma. So basically what it was this little pad that we gave people. They stuck it in between their teeth and their gum to have that sort of liquid suck up into the pad. And then they put it in this little vial of liquid to preserve it, and then they sent it back to us. So our intent with that was to see whether we could measure inflammatory cytokines through a non-invasive mail order sort of approach. The problem was that many times the little vials came back dry and we have no idea why. So that was our attempt to quantify, to get plasma remotely. We need to work on better ways of doing that. There's probably longer information than you want, but for the remote study, I think it probably is worth the extra money and effort to basically have the person go to, I don't know whether in Canada you have Quest or LabCorp, basically a national lab chain, that they go to the lab chain, they draw the blood, and then they ship it FedEx on ice back to us. I mean, that's extremely expensive, on the order of probably over $100 per draw, but it's probably worth it.
Excellent, excellent. Another question is how important is it to eat organic foods?
That's a good, that is an excellent question. And I don't feel that I'm qualified enough to really answer that. There are, I mean, just from my own as a, listening to talks and things like that, there are specific fruits and vegetables that, people say, you should really focus on organic foods for those specific fruits and vegetables, and other ones maybe not so much. I think probably, I mean, I'm not going to say it's not important, but organic foods are usually more expensive. So I also want to make sure that I, be cognizant of not forcing people to go out of their budget. I think it's probably more important that, you select whole grains and beans and, rather than, springing for the organic foods. I'm just saying, I guess I could say, if you can afford it, yeah, go for it. But I think that may be a luxury that many people just can't afford.
Absolutely, absolutely. Another question is that Mediterranean diet might be very healthy for Greek people and other Mediterranean people. Have these studies been controlled for this type of population, and perhaps different populations could have different genetic pools that are fitted to the food that they originally grew up in those places? Comments on that?
That is a really great question. Many of these large Mediterranean diet studies were done in Mediterranean populations. So one could think that, yes, their bodies were sort of adapted to eat that like that. I don't know how to answer that. I think I'll skirt around the issue and saying that maybe we are focusing on a Mediterranean diet eating pattern that I think it would be difficult to say that certain fats, which we say are bad versus good, the bad fats would be good for a certain population of people. I think that would be hard to sort of conceptualize, but maybe one approach, and this is what a Mediterranean diet eating pattern can do, is, you take your own culture and you say, okay, I'm going to sort of adapt my cultural eating style to a more Mediterranean diet eating style. But I totally agree that, what may be good for one person may not be good for another.
Absolutely. Great. So another question, and we just have a couple more here, is do you have any plans of looking into the keto diet and MPNs? This might be anecdotal, but I have noticed a seeming correlation between adherence to ketogenic diet and hematocrit level. Would love to see if there's a real correlation that holds true for other people.
Yeah, the ketogenic diet is a very interesting question. And I have to admit, I am not personally looking into it. Robin Sherber, who has now since moved to industry, she previously worked with Ruben Mason. During actually medical school, she developed the MPN SAF. She was planning a study of keto diet in MPN. I am not sure of the status of that since she moved to industry. I don't think it was moving forward, but that's definitely an open question. I mean, from my perspective, I have to say that personally, I couldn't follow a keto diet. So I'm maybe trying to focus on things that are easy for anybody to follow. If I can't follow it, how can I expect somebody else to follow it? And I also, do you mind if I answer one of about my website and putting the name in for the nutrient study? I want
sure.
to say I do need to change the website a little bit. We are not, I want to continue to get people's names. We don't have the study open because we need to obtain funding for a study before we open it. So I'm sorry if people have been putting their name on the website and I haven't been responding. I need to change it saying that we're not open yet, but please put in your name so that when we are open, we can contact you.
Absolutely. Wonderful. Great. And also another question is here, and we know that this is kind of holistic for many different types of patients, but why is grapefruit not to be eaten while on a JAK inhibitor?
So grapefruit can alter the level of certain medications, such as JAK inhibitors, for actually for a lot of different medications. So not taking grapefruits with a lot of different medications is sort of contraindicated because it can alter the level of the medication.
Perfect. And one of the, we just got a couple more questions that have come in, but one question is I have PV and haven't been told to restrict iron. Are there studies that have been done on this?
So with PV, so the central concept of PV, in particular with phlebotomy, is to induce iron deficiency, because if you don't have iron in your body, then you can't make red blood cells. So that is the whole purpose, unfortunately, of phlebotomies, is to make the person on purpose iron deficient. If somebody's, I don't particularly, emphasize that people should really avoid iron, but somebody with PV should try to limit their iron, in particular if their hemoglobin hematocrit is high. I mean, if they're getting phlebotomies and then they eat iron, they're just going to get more. You're just going to need more phlebotomies. That's not a big deal, but you're going to need to drain the blood so you can get rid of the iron that you just ate. That's part of the, some people who are on Jakafi, ruxolitinib. I don't know whether in Canada Jakafi is approved for PV.
Yes, Jakafi. Okay. Yeah.
Or if you're on Hydrea or interferon, that those can manage your blood counts such that, even if you do have sufficient iron, your blood counts will still be low. Interestingly, a whole new class of drugs that I'm assuming there are clinical trials open in Canada, just like there are in the US, as a rusfertide is the most furthest along.
Yes, they're just coming in, actually, the clinical trials.
So with those drugs, so rusfertide is the one most far along. There's other drugs that are similar concepts. Basically, it tricks your body to think that it's iron deficient when it's not, when it's really not. That it just makes it so your cells can't use the iron, but your body has iron. So that's sort of the concept with iron deficiency, or sort of simulating iron deficiency as a treatment for PV. But I mean, I don't think that PV patients really need to go to the extreme to really exclude iron, because a lot of times these iron-rich foods are very healthy foods for you.
Absolutely. Absolutely. So another question here is, and we just have a couple more, is should patients alternate their probiotics from time to time? And should probiotics be taken constantly or periodically?
So with the probiotics, I think it's unclear, from my perspective, the benefits of probiotics, as well as which probiotics to take. I think the concept of having a healthy gut microbiome is very important, but whether or not, taking a probiotic is going to make your gut microbiome normal is, in my perspective, a little less clear, as well as there's lots of them out there. So which ones you pick? So I really don't know how to answer that question, because I just don't know how strong of data we have for probiotics, in particular in patients with myeloproliferative neoplasms. So potentially, from my perspective, maybe a better way to make your gut microbiome really healthy is to eat healthy.
Absolutely. I think we can all eat. Yeah. Look at trying to eat more healthier for sure. And our last question is in addition to diet, do other holistic things like yoga and meditation have a similar positive impact on MPNs?
Yes. So that is a great question. And there is lots of data, but data coming out. There's an investigator, Christina Gowan in Arizona, who has done some yoga studies and is very interested in mindfulness in MPN patients. So yes, I mean, it's gotta be it's gotta be helpful in patients with MPN. I think also exercise is very important. And I think that, maybe 10 years from now, we'll, do studies where we put all together, like we do diet, we do mindfulness and yoga, and we do exercise all together as sort of an approach for I would say optimizing health in MPN patients. But to begin with, we wanted to sort of single out diet, because if you do a study with diet and yoga and meditation and exercise and you see benefits, how do you know what the benefits from each are? So I think we need to sort of piecemeal each component out first and then put them together.
Absolutely. Yeah. I think the stratification of each component will really enable our physicians and our researchers and scientists to get a better, affirmative action from each of those combined. Absolutely. No, to your point. And our last question is can you suggest a good cookbook or the best cookbook for practicing the Mediterranean diet?
Oh, I have to say, I don't have a recommendation. One thing that, and maybe people can chime in, one thing that we were thinking about developing is a sort of an MPN specific Mediterranean diet sort of cookbook. There's a lot of stuff now online. I look at my cabinet and I see all these cookbooks, but do I ever really look at them? What I do when I want to make something is I go search online. But our curriculum would have like sample meal plans and recipes. So I'm sorry, I can't give a specific diet, a specific cookbook. Whenever I go to bookstores, I flip through them. But then I say, well, if I buy this, it's going to go on my shelf and I'm never going to look at it. So,
well, maybe that's something that the Canadian MPN Network can take on as a project in putting together. Food for thought.
I mean, one thing that would be really neat would be basically a contributions from MPN. That I was thinking, like, people could contribute their own recipes and say, this was really great. I really love this. When I made this, I felt so, my itching went down the next day or something like that. I think that would also build community and be something neat for the MPN community to do.
Well, my light bulb is going off for the network, so definitely. So I'll turn it over to Doug to finish off this segment.
I think I have just enough voice left to thank you, Dr. Fleischman. When I saw you at the conference last weekend, it was really obvious how highly respected you are by your colleagues. And they were listening attentively to what you were saying. I hope you remembered to take home the gift that I gave you as a thank you.
I was actually going to, me and my husband have actually, those were actually extremely nice gifts. Good. Thank you very much. And I was going to, drink something out of it, but I thought, well, they're wine glasses and maybe it's a little too early to be drinking out of those. It's only 10:30 here. So, but thank you very much. I really enjoyed meeting you, although very briefly at the meeting, and I will, we use those, I have to say, we do use those wine glasses every night since since I brought them home.
Well, hopefully they'll last a good long time for you then
Yes,
too.
they're nice and light, nice and sturdy. So
Yep.
yeah.
Stemless wine glasses. Yeah. So thank you very much again. And it looks like it's 11:30 here Mountain Time, 1:30 on Eastern Time. We're going to take a break for about 10 minutes. So if you can mark your clocks for 11:40 and 1:40 in Eastern Canada, then we will get back together again. We'll just have some slides of music for about the next 10 minutes. Thank you again, Dr. Fleischman.
Okay. Thank you very much.
Welcome back, everyone. I hope you had a chance to get a refreshment and to stretch a bit before our next presenter. Our next presenter is Kimberly Dice, who is a physiotherapist from Advantage Sport Medicine Physiotherapy. She has a Master's of Science in Physical Therapy and a Bachelor of Science in Kinesiology, both from the University of Alberta. I have come to know Kim and the owner of Advantage Sport Medicine Physiotherapy over the past few years since I was informed that I needed to build up my muscle mass that I had lost since I had been diagnosed with my MPN, which is PV, 8 years ago, and that I needed to have my body become stronger and my muscle mass bigger because I had 2 surgeries coming up. After explaining to both of these people that what I needed and what an MPN was, especially my PV, and how fatigue is such a big issue, bone pain is an issue, and that I don't often eat a balanced diet as I used to, they compiled a program that has totally worked for me and I continue to use. I could complete all the exercises on the floor, sitting in a chair, or standing in my bedroom. I didn't need a ton of equipment or a lot of room. Both my husband and I could not believe the strength in my leg and the texture and the muscles that were built up, and how then after my surgery, my hip was so much better and a very fast recovery. The program they developed also worked on other parts of my body, which I know made the difference as well. I truly believe that this quick recovery from surgery is due to all the physical improvement around my body. So Kim is going to demonstrate to us how to improve our quality of life through movement. If you would like to participate, you're more than welcome to. She will show us how even the simplest exercises, even while sitting watching this webinar, will improve blood flow in our bodies, which we know is a big concern, and help improve our quality of life overall. She will share a preventative approach to training, focus on improving our movement, strength, and conditioning, and then our overall athletic development. So welcome, Kimberly.
Hi, everyone. Thanks, Patty. Let me just share my screen here. Okay. Yeah. Thank you, Patty, for the introduction. As Patty said, I'm Kimberly Dice. I'm a physiotherapist, and I'm here just to talk about how exercise and movement might be able to help support you guys with your quality of life and your well-being, especially living with an MPN. So again, this is me. I'm Kimberly Dice. I am here in Edmonton, Alberta, where it is a balmy -25. I hope it's warmer wherever you guys are. I am originally from Saskatoon, and I have my Bachelor's of Science in Kinesiology from the U of S there, and ended up in Edmonton at the U of A for my physio degree. I work full-time right now at the University of Alberta Hospital in the intensive care unit. And there I get to see and promote exercise and movement in lots of patients with chronic conditions and very acute stages of their illnesses. And I get to see just how movement helps expedite them in their recovery and get them moving and on that path back to their discharge home. In my full-time job, I also work on the burn unit. So all the major burns from Saskatchewan and Alberta will end up with us. And there I get to see the true power of regeneration in the body, even after such a traumatic injury like a burn, and just how much stress a fragile tissue can take. And so I think all of that kind of compounds for me just how powerful exercise and movement in our body is in our everyday lives, and how much it helps us heal and what healing properties it has. And so I hope to just kind of share and explain that side of things to you guys today, and I hope you each take something from it. On the screen here, you'll see two pictures. So on the left is my dog Tuck, and he's a 90-pound bundle of joy. He's about 8 years old, we think, and he still runs all over the place. So movement and quality of life for me in my life is taking him, getting him out of the house. I apologize if you hear him whining throughout our thing here. He's reminding me that he hasn't gone for his walk yet. So I've had a talk with him, but we'll see if he listens. And then also snowboarding is something I really enjoy and adds a lot of quality of life to my life, especially in the winter. Living in Edmonton, you have to find those strategies to still get active outside. So it takes me lots of beautiful places with lots of friends and family. And so that's kind of what movement and looks like in my life right now. So before we dive into the full, I just wanted to reiterate that I'm an exercise specialist. So I have my kinesiology degree, I have my physio degree. I'm unfortunately not a specialist in cancer rehab or even an MPN diagnosis, but I'm hoping to just share how exercise and movement, even just where to start, can help you guys on a journey back to doing what you know and love. I believe wholeheartedly in exercise and how it can improve everyone's physical health. And also I get to see time and time again every day, which is why I truly love my job, just the power that it has. So I'm happy to answer any questions at the end, and feel free to put them in the chat kind of as they pop up as best as I can. But I just wanted to reiterate that if there's any like specific questions that you have or concerns before you start your exercise program, it would be best to see a physician or a health professional near you who has the privilege of assessing you and getting to know you personally, and they can give you more specific recommendations than I can. But I'm hoping to just kind of ignite a spark and get some interest going in how exercise could fit into your lives, okay? So getting started here. We are at the MPN conference. I feel so privileged to be here, especially with a network getting so innovative in looking up strategies and things for your guys' condition. And so my proliferative neoplasm. So what we know is it's going to affect the proliferation of bone marrow cells, and it's considered a hematological cancer. So on the screen here, there's pictures of the cells that are most affected by MPNs or more commonly affected. And each of these, the ones that's most affected in your subdiagnosis or category of an MPN, is going to vary based on which cell is the most affected or the cells that you're having difficulty with. And each of those are going to affect the symptoms or that you're experiencing, and the ones that you feel most predominantly. So we know your red blood cells, your platelets, your megakaryocytes, and then your granulocytes. So your granulocytes are going to make up your white blood cells. And those are your neutrophils, your basophils, your mast cells, and your eosinophils. And so depending on which of these cells you're either overproducing, you're underproducing, or you're producing immaturely, which just means that they aren't developing to a stage where they're going to function optimally, you are going to experience different symptoms, and different ones more predominantly. And that was something that I found when I was reading up on MPNs and trying to understand your diagnosis. The most predominantly was the symptom burden kept coming up over and over again. And so I know there's quite a wide array of symptoms, and everyone experiences them differently based on your diagnosis. And this list here is not a complete list. It's just the ones that I felt kept coming up and I kept reading about, kept coming up most commonly. And so that's the fatigue, the reduced concentration, the decreased appetite, the bone pain, the itching, the night sweats, and the poor sleep quality. And I, again, know this isn't a comprehensive list. And so potentially in the chat box, if you feel comfortable, maybe sharing other symptoms you're noticing and how that aren't on this list. And then potentially we can talk about how exercise is going to change those for you, or symptoms that you would like to see changed. And I can help kind of explain how exercise could be beneficial for that. So if you want to put that in the chat box, even just for my learning. And so, yeah, so I think if we look at this list, it's pretty clear how this is going to affect our day-to-day lives and our quality of living, especially when we're dealing with that fatigue and the bone pain, the itching. Any reduction in sleep is going to make tasks harder for sure. And so in my research on how exercise relates to an MPN diagnosis and how I'm going to better help you guys, this quote on the left really stuck out to me, even as a physio, but even just as a person. And it reads, "My body is the thing that prevents me from doing what I would like to, and it's something that would be hauled with me in activities." And so this quote is from a study that was trying to understand the experience of patients living with an MPN and exactly how after their diagnosis, their symptoms impact them. So to me, this quote, you know, your body is now something to be hauled with you, and it's the barrier that prevents you from participating in your daily lives. That's hard to read, and you can see how that would be a big barrier, right? Your body should be something that's going to support you and carry you through those things that you want to do. It should empower you to move forward and do those activities. And it's really the thing that transports us throughout our whole lives. And so as a physiotherapist, I read this and I'm like, okay, so how can I facilitate exercises and movement to help you feel more connected and in charge and in control of your body, and to not have it feel like that dead weight that's in the barrier of you participating in those activities that you want to be doing. Headaches. So in the chat here, yeah, headaches is a big one. Migraine and insomnia. Yeah, and those for sure can be big barriers to having energy, having even just like the mental capacity to think about doing something, to actually get up and do it. So yeah, big symptoms that are gonna feel like they get in the way of an exercise program or activities that we need to do throughout the day for sure. Thank you for sharing. Okay, so highlighted at the top there, is the fatigue one. And fatigue was something, especially in getting to know Patty and Patty giving me the privilege to share her experience with me, was something that I felt was very kind of overarching in our conversations, but also in the research, especially that quote. So your body is the barrier, the tiredness and the fatigue is just the thing that's holding you back from participating in activities. And so this isn't specific to an MPN. And in all cancer research, symptoms are related to cancer. Fatigue is actually proven to be the most common lasting symptom that's going to stick with a patient following a cancer diagnosis. And it can actually affect people up to 5 years post-diagnosis. Now, the unfortunate thing about fatigue is that it is going to be exacerbated by our medications, potentially our cancer treatment, so our radiation and our chemotherapy, but also just that inflammation that even Dr. Fleischman talked about. Any inflammation in our body is going to worsen those cancer symptoms and that fatigue specifically, because now our body is dealing with all of those cytokines and there's so much going on in the background that our body is physiologically trying to deal with, and that's going to burn out and tire out our symptoms. So we're going to end up feeling this fatigue. Now, the problem with fatigue being such a big symptom is that it's almost like this umbrella symptom that's going to have a trickle down effect on each one of our systems. So if you're dealing with fatigue, you're going to have physical systems like muscle weakness, reduced endurance, poor motor control, difficulty with and reduced activity capacity. You're going to get more tired quickly. You're not going to have as much of a reserve to get up and do those things that you need to. There's going to be mental effects of that. So you're going to feel like you're in a brain fog. You might notice you have poor concentration. You might start feeling like you're having difficulty remembering or reduced memory. Now, not only is fatigue going to affect you psychologically, but dealing with these physical and these mental trickle-down effects is also going to impact you psychologically as well. So now you have compounded anxiety or depression, reduced mood, poor sleep quality and insomnia, and all of that can affect our ability to socialize and participate with our friends and family and go to events. And that all, again, kind of compounds us on these other symptoms. And so this is cancer as a whole, and fatigue in general. But in the research, actually 85% of patients with an MPN will report fatigue as their most predominant symptom. And then to further that, fatigue is most often the symptom that patients with an MPN are going to report they would like to change. And so potentially you can just share in the chat box whether you agree with that or not, but I thought 85%, that's a pretty high number. And especially thinking about how much we just established fatigue is going to affect us every day. That's drastic, right? So also, there's not a lot of specific research on exercises related to an MPN. I'm happy to hear that there's more yoga studies coming out and how that's going to relate to a diagnosis. But in this study, they actually found that MPN patients who reported higher levels of physical activity also reported lower levels of fatigue. And so MPN patients who were physically inactive, fatigue kind of started compounding and having more control over some of those symptoms. And now this is huge because in all cancer groups, exercise is actually proven to be the #1 and the strongest strategy in reducing cancer-related fatigue. Okay, so exercise has a huge impact on how we can start to control, manage, and actually lessen our fatigue, which, as we've talked about, lessening our fatigue is going to help all of our other systems start to function more optimally. And it's going to unweight those other systems and let us start progressing and getting back into those things and building our endurance. So fatigue, we've established, is going to interrupt our ability to participate in those activities of daily living and also thus heavily impact our quality of life. And what I would really love, if you guys would share with me in the chat, is what quality of life means to you. It can mean lots of different things to different people. Oftentimes we define it as being able to participate in meaningful activities, whatever that looks like for you. And so I would just love if you shared with me, when I say quality of life, like what kind of things are you looking for, or would you like to be able to do to support that quality portion of that statement? And while you guys might be thinking or digesting about that, I'm sure you're also kind of wondering, okay, so Kim, how the heck is increasing my activity actually going to reduce my fatigue, right? It sounds a little counterintuitive, like how am I going to burn more energy and how is that going to make me feel less tired? Well, luckily, they've done lots of research. And again, unfortunately, this is just in a general cancer group from the American College of Sport Medicine. But each of these outcome measures that you see on the screen have all been proven time and time again in all cancer groups, including hematological cancers, to be improved by exercise. Okay, so you have an improvement in your cancer-related fatigue. You have an improvement in your health-related quality of life. Physical function is going to get better. Your anxiety and your depression is going to improve. Potentially, you have an improved sleep quality because now your body's burning more energy, so it can rest more effectively over the night. Lymphedema, and then also an increase in your bone health, which in an MPN, right, we're talking about a pathology of most predominantly our bone marrow. And so improving our bone health is going to help support and facilitate the production of those cells in our bone marrow. Actually, exercise is used and being studied as an alternative to a granulocyte stimulator. So it's actually going to help encourage our body to produce more of those cells within our bone marrow. And so it can also support that bone marrow in producing them less immaturely and more to that optimal functioning stage. Now, there's a number of physiological ways that exercise is going to produce these in your body. You're going to have an increase in your muscle strength. You're going to have a change in your muscle fiber type. So you're going to have less fast twitch fibers. Fast twitch fibers make you very powerful, so strong and doing things quickly for short periods of time. You're going to start changing those over to slow twitch. And so that's going to make you have better endurance. Those muscle fibers are going to be better at using oxygen. So they're not going to fatigue as quickly during an activity or a task. So you're going to be able to do something for longer without getting burnt out. Your blood cells are going to be better at responding to hormone changes and oxygen demand. And so you're going to be more efficient at carrying oxygen and delivering oxygen to your muscles to help them last longer. It's going to increase your endurance. Dr. Fleischman talked about inflammation in our body, and actually it's proven in the research that 5 to 10 minutes of exercise one time is going to reduce inflammatory cytokines in your body, even after just one bout of exercise. So even just exercising one time throughout the day, you're going to start working on that inflammation and helping to get that down. And that's going to free up some space for your body to focus on other things. You're going to have an increase in the release of your serotonin and your dopamine that's naturally released in your brain. And then not only are you going to increase how much you're releasing, you're actually going to have it available longer to your cells. So your cells are going to have a longer time and a better chance to take up and use those neuromodulators, which is going to help with you psychologically and with your sleep. So there's lots and lots of different ways, but I think it's important. And I just love to come back to the fact that even exercising one time starts working on all of these outcomes. And so lots of benefits there. And even if we go back to Dr. Fleischman, working on reducing our cardiovascular risks, right? So exercise has been proven to reduce cardiovascular risks, reduce blood clot risk, reduce stroke risk, all very specific MPN considerations that we want to focus on, right? You're going to improve your blood pressure, you're going to improve your cholesterol. All of those things are just going to compound and help not only with your symptoms, but with your longevity as well. And so going to the chat box, quality of life is having more energy to do what you used to do, being able to keep up with your parents and your daughter, joy, live, work, and love fully. Yeah, all of these things, right? We're talking about traveling, going for walks, not reducing our pain, having a better mood, a positive outlook. Yeah, thanks for sharing with me, guys. But all of these things, energy, joy, improving our mood and our outlook, all these things have been proven with exercise to be changeable and improved with even a single bout of exercise. And so, oops. Safety first. So we've established how exercise physiologically is going to impact our fatigue and what symptoms we're hoping to change. But especially when we're living with a chronic condition and we want to start participating in an exercise program, especially when you're dealing with a handful of symptoms, it's important to make sure that we know how to do that safely and successfully so that we don't exacerbate anything, but we also feel confident participating in that. So research actually supports that you don't need to leave me today and go and see a physician or get assessed by a health professional to start participating in a low intensity exercise program. So that includes aerobic training, resistance training, as long as it's progressive, and a flexibility program. And so what I'm going to be talking about today is a low intensity program. Low intensity has actually been proven to be most effective at changing and reducing cancer-related fatigue. And so it doesn't have to be anything higher than that. Now, if you guys are already working out and having activity at low intensity and you want to start increasing that to a moderate intensity, potentially I would recommend seeing a health professional just to make sure that you can have all your questions answered. But if we're starting with a low, then you guys are safe to try some of these strategies today and just monitor how you feel afterwards. Okay. And that's proven. So MPN specific safety considerations and how that's going to relate to either your diagnosis or some of the symptoms that you've been noticing. Most predominantly, we're going to keep talking about that fatigue. And I think it's going to be important talking about an exercise program for each of us to understand that every day is going to look a little bit different and not every day is going to be a good exercise day. Okay. On the days where you're having that extremely severe fatigue and you're having difficulty participating in even the most basic of your daily activities, like your peri-care, bathing, even getting up out of bed, eating, those sorts of things. Okay. If you feel like you would rate your fatigue at a higher than a 7 out of 10, that's a good rest day and not a good day to do our exercises. Okay. Rest days, when you start your exercise program, is just as important as our active days because your body needs to also be able to recuperate and recover in between to be able to respond to the changes you're asking it to make. Okay. And so if you're dealing with severe fatigue, I just want you to make sure that you are checking yourself on what days you're choosing to exercise. We would probably be looking at starting with, for sure, the lower intensity, and then also starting with that 5 to 10 minute bouts. So I'm going to talk to you about the goal dosage that research supports for those outcomes we talked about before. But starting with those 5 to 10 minute bouts, seeing how you feel after, giving yourself adequate rest in between. That's going to be a good place to start if this is something that you're really dealing with. And even just making sure you're giving yourself like proactive rest. So sitting before you feel like you really need it, or not pushing yourself into that extreme tiredness before you give yourself a rest break would be the modifications I would make for that one. Now, anemia, so having that low or immature red blood cells, that's just going to reduce how effective your blood is at transporting oxygen. So once you start exercising, your muscles are going to start increasing their oxygen demand, and your body is going to have to increase its oxygen delivery to meet that demand. And so if you're anemic, there's just going to be a cap at how effective and how efficient your body's going to get at that. And so again, you're going to want to keep it low intensity so that you're not working or increasing your oxygen demand higher than what you can deliver. Lots of rest breaks. If you start to notice you're getting lightheaded, just make sure you can have a seat whenever you need to. Okay, that might just be a sign that your demand is out, weighing your delivery. So just, again, make sure you come back to those rest breaks, and you monitor yourself for any of those kind of symptoms. Neutropenia, so that's a low white blood cell. So if you have neutropenia, you're probably well educated and practiced in how to keep your infection risk quite low. I would start with exercises at home and things you can do on your own or with family or people in your close inner circle. And then if you start to feel confident in that, you could look at group classes or going to like a swimming pool or somewhere public, but just being cognizant of reducing your infection risk. And if you are dealing with an infection, then we're just going to lower our exercise dosage during that time, just so you're not burning out your body and burning out that energy. So your body still has enough energy with its white blood cells to fight that infection for you. Thrombocytopenia, so that's a low platelet count. So platelets are the main clotting factor in your blood. And if you are dealing with a low platelet count, we're just going to focus on doing our exercises in a predictable environment and picking exercises that are going to reduce our risk of injury or falling. Okay. So the concern here and what we're going to want to modify is just not doing activities that are going to promote injury or where you might fall and get a cut that is going to lead to prolonged bleeding. So things like walking, swimming is really great for this one. Stationary cycling. I would also keep it low impact. So jumping or running is totally doable. Just make sure you know what your platelet count is and monitor that. Any type of exercise and impact is going to cause small injuries to our vessels and our muscles, which is how we facilitate the rebuilding in our body to make us stronger and to make those changes and adaptations. So that's totally normal, but you might just want to be more aware of that and cognizant. Now, I believe it's if your platelet count is less than a 15,000, exercise is actually not recommended for you that day until you can get your platelet count up. And so if you know your platelet is usually around that very low level, that would be someone I would recommend checking with your physician before you start participating in one. Okay. Decreased appetite and nutritional deficiencies. So I know sometimes it's hard to eat or be interested in eating. And with exercise, it's just important to make sure that if you're going to increase your energy expenditure, that you are able to adequately replenish that energy that you're burning. So either timing your exercise with an appetite intake, or increasing your protein is a great strategy as well. So protein is the main source that your body's going to use to build muscle. So like eggs, peanut butter, your meats are great protein sources. And so being more selective in what you are eating when you are going to eat to make sure that you're giving your body the right fuel source to replenish yourself after that exercise. Okay. And then enlarged spleen. So that can potentially, because your spleen's located underneath your lung, just affect how much you're going to be able to expand your lung. And again, we're just going to keep it low intensity so that you're not overworking your demand to where your lungs can't expand enough to meet delivery. Okay. At the bottom here, I just have any new onset of pain, shortness of breath, or exacerbation of your symptoms. You should just touch base with your medical professional. Shortness of breath is normal. An increase in your rest rate is normal with exercises, but shortness of breath is more where, you've given yourself a rest break and you just really can't get back in control of that breath. Talk to a medical professional before continuing at that intensity. Okay. So this is from the American College of Sport Medicine, and it's their campaign called Moving Through Cancer. It's a really great campaign, and I would recommend you guys to Google it if you had any further questions or you wanted to read into this stuff further. And this is a cancer group research that they found, the one that proved the benefits that I talked about earlier. So this dosage at the bottom here, the aerobic training 3 times a week for 30 minutes, plus or minus 2 days of resistance training, is the dosage they found effective at producing those outcome differences or those outcome measures that I talked about earlier. And so what I want to talk about here is that it's a goal of 30 minutes, 3 times a week. Okay, this 30 minutes can be done in bouts. So like I've talked about the 5 to 10 minute bouts. You could do cumulatively. So if you were going to do like your 3 days a week, you could do 3 10-minute bouts that day, and that would still give you the 30 minutes. You could do 6 5-minute bouts that day. So it doesn't have to be all at once. I don't want you to look at this and think, oh, wow, 30 minutes, that's kind of a long time for me to last at something, especially in exercise. You can totally break it up throughout your day and you're going to get the same benefits. Okay. Resistance training 2 times a week. So that's for building muscle mass and endurance. And we're going to talk about a little bit of a resistance training program. Now, resistance training can look like many different things. It doesn't mean we're going to go lift as heavy of a weight as we can in the gym, but yeah, so that's a benefit as well. And then the big thing on here as well is the 8 to 12 weeks. So we're talking about low intensity programs, and as I've stated, low intensity exercise has been proven to be more effective at reducing cancer-related fatigue than a high intensity or a moderate intensity exercise program, and even in combination with resistance training. So the biggest factor in getting these benefits is actually consistency and making this a part of your lifestyle and having activity as part of your habit is going to get you those benefits more so than worrying about how hard you are actually exercising. Okay. So these benefits, if you were to try this 3 times a week for 30 minutes or 3 times a week, starting at whatever amount of time you're starting, you're going to see benefits in about that 8 to 12 week time. So exercise, unfortunately, and I wish over and over again that I could make exercise like 2 to 3 times and you feel entirely better. It's not a quick fix. It's got to be a lifestyle habit and something that you work into your weeks and your lives and things that you enjoy doing to get you these benefits, but it will pay off for you. And it's just the consistency that everything comes back to where those benefits are found. Okay. Now, the other thing I want to point out is this middle blue box here. So to get started, they recommend just simply avoiding inactivity. And so moving more and sitting less benefits nearly everyone. And so on those days where, or even if starting with a 5 to 10 minute bout seems like too much right now, that's totally understandable. And that's totally fine given what your body is going through. However, it doesn't have to be complicated and it doesn't have to be anything more than just standing. We're going to go through a scale later on here to know how intense you're working out, but it even talks about how just standing is a 1 out of 10 on how difficult our exercise is. Okay, so anything that's not sitting and is moving more can count as activity for you. And that's a great place to start. And that's totally fine to have to start there. So to sum up what I've been talking about, our starting point just to start us on our path to getting all of these outcomes, and this is where you're going to get these outcomes from, is a consistent, low intensity aerobic activity that's just going to get you moving more and sitting less. That's the exercise that's been proven to reduce cancer-related fatigue, and that's where you're going to start feeling better. Our goal is about 30 minutes a day, about 3 times a week, but we can do that within 10-minute bouts. So again, don't feel like you have to get up and run a marathon or set a timer for 30 minutes. And if you can't make it, it doesn't count, because that's not true. If you can start with even 5 to 10 minute bouts, then you're well on your way. Okay. So how the heck do I know if I'm at a low intensity or how hard I should be working out? So this is a RPE scale, stands for rate of perceived exertion, commonly known as a Borg scale. So this is very Googleable. I think that's a word. There are some that if you Google this, you will find a 6 to 20 scale. I prefer the 1 to 10. I think it's a little more understandable on how I feel. So like I said, a 1 is a very light activity. And so that's anything that's just not resting. So that's anything that's more than standing, laying down, or sorry, more than sitting or laying down. Could even just be standing, walking, light chores, anything like that. A 10 is what you're going to imagine a maximal effort would be for you. So it's something that you're not going to be able to sustain for a very long period of time. You could maybe do it for about 10 to 15 seconds before you would be completely out of breath. For me, I imagine this is what running a marathon might feel like. And so that's what you're gonna work in between. So where we're gonna live for a low intensity exercise program is a light activity, okay? So that's a 2 to 3. You're working at a pace you think you could maintain for a few hours if you really need to, and you feel like your breathing is free and easy. So you're not really getting into that quite like panting sort of breathing, but you feel like you have a good control over it still. You might notice a slight increase, but I like to say that a low intensity exercise is something that you could keep singing a song through and you're not going to miss any words or skip any beats, okay? Now, if you were going to start working on moderate activities, that's where you're going to start getting into a little bit more of that breathing heavily. You can still have a conversation, but singing might be a little bit hard. And that would be a 4 to 6. So for the purpose of today, we're talking about staying within that 1 to a 3 out of 10 range. Now, for those of you who are technologically savvy, and monitor your heart rate or have an Apple Watch or the ability to monitor your heart rate zones, a light intensity is going to be something that's 60 to 70% of your heart rate max. And so for most of us, a light intensity is going to be between about 100 to 125 beats per minute. Okay. There's an equation to calculate your exact heart rate, which I can go through over if anyone would like to know that specifically, but you're looking for a little bit increase in our heart rate from rest. So that 100 to 125, 130 range. Okay. So a functional strengthening program is where we're going to talk about for resistance training to improve our function. Okay. So increases in our strength. Aerobic activities are great for all of those, increasing in strength, increasing our endurance, getting our blood flow going. Fantastic. Resistance training adds a little bit of an extra oomph in just increasing and stimulating changes in your muscle mass, and also goes further in increasing your bone health, just because we get those muscles pulling on our bone, and that's where our bones are actually going to get stimulated to respond to that load. So this is 4 exercises, body weight exercises. I love body weight exercises. I tell lots of my patients all the time that a body weight exercise actually doesn't need any load to get harder. As long as you're focusing on high quality form, and you're increasing your holds, making sure you're learning how to activate muscles differently, you can make these as hard or as easy as you need to, okay? So on our push movement, she's doing it on a table. I would recommend doing this on like a counter or something pushed against a wall, okay? Now, you could start at a table or a counter, but this is also as similar to doing it on a wall. So if you start at an incline and this is a little bit too challenging still, just move it to a wall. That's still going to give you the same benefits. And this exercise, so you're going to work on the major muscle groups of your shoulders, but you can also work on your core here. So activate your core. That's going to give you lots of proximal stability. And that's going to make you stronger from the inside out. And so having good core stability is going to be important for having a good proximal base for your legs and your arms to work off of. Okay. So you're just going to do a push-up movement. Elbows are going to come out to the side. That's a great, easy one to do at home. A pull movement. So this one is a whole body exercise for sure, because now you're holding that partial squat. Okay, so you're going to get muscle building in your legs there, and then you're going to work on the major muscles of your back and as well as your core, because you're holding that position. So he's holding dumbbells here. I've done this exercise with a towel, and then you're just pulling it apart with your arms to activate more of your shoulder girdle. I've done it with soup cans, water bottles. My physio degree gave me lots of heavy textbooks, so I've used my textbooks for weights before. So really you can do whatever you have around your house to help give yourself a little bit of a resistance, okay? Lunges and sit to stands. So these are very compound functional movements to start building that lower extremity strength, which is going to help with your endurance and stability. And so a lunge is a fantastic single leg strengthening exercise that's also going to work on your balance, reduce your risk of falls, and build that muscle strength, as well as a sit to stand is an important functional movement that's similar to a squat. So you're going to get stimulation in your quads and your glutes there. I think I've talked a little too much, but I can demonstrate these in the question section if anyone is interested in knowing more about those. But even just starting with these 4 exercises to fulfill that resistance training recommendation, you're going to hit all your major muscle groups here. And it doesn't have to be any more complicated than what you have available at home, even your soup cans. And so I think functional strengthening, especially when we're talking in the context of fatigue, can be anything. And it can even be vacuuming, gets our heart rate up pretty good. And you do have resistance pushing and pulling on that rug. Even lifting dishes up from the counter and up to a shelf, that's great functional strengthening. And then you're kind of tackling 2 birds with 1 stone, right? You need to put the dishes away, you're getting your strengthening in. That can count as well. So exercise comes in all shapes and sizes. I've talked a lot about how compliance is one of the most important factors here. And so I think one of the biggest things in making it a lifestyle habit and a change is picking something that you love and enjoy and are going to look forward to doing it. I don't want exercise to feel like a chore. I want it to feel empowering. We've talked, your quality of life is being able to keep up with your parents or your daughter, or spending more time with loved ones, going for a walk with them, doing like a YouTube home exercise video with them, participating in activities with others is a really great way to make it a lifestyle habit and change, and also improve our quality in life while we're doing it. Resistance strength training can be anything that we're practicing at home or adding a little bit of weight. It could be a formal home exercise program from a physio or a trainer. Working on our balance is great. We're working on that motor control and our endurance. Yoga, Tai Chi, swimming. Group fitness classes are also nice. I find I use them in my life because they keep me motivated and accountable. In Alberta and in Alberta, even rurally, the University of Alberta participates and does this thing called the ACE study. And so that's the Alberta Cancer, I can't remember what the E stands for, exercise research group, and they do group exercise classes that are specific to those with a cancer diagnosis. And so if you Googled in your area, you might find something similar to that, and then you might feel like you have more of a support group there as well. And so I just want you to remember that pick something you enjoy, give yourself realistic goals. Remember, all days are going to start and look differently, and so your exercise might look differently as well, and that's okay. Okay, so just to wrap up here, I hope that you all can kind of take this last little sentiment as what I tried to inspire today, in that exercise can be a great tool in changing and starting to change and getting more control and feeling empowered in our bodies, and that it doesn't have to be complicated and it doesn't have to burn us out. So it's just about starting where you are, using whatever you have available to you and doing what you can, regardless of what that looks like day to day. Okay. I think there's a misconception sometimes that if you're not exercising or, like running a marathon or pushing it heavy to the metal, that it's not going to give us benefits. But I think in the research, especially when we're living with a cancer diagnosis, it's really just about doing anything that's more than sitting and starting with what we have and just avoiding an activity. Okay. Moving more. Accomplish all those goals. Okay, thank you guys. Does anyone have any questions?
Wow, what a lot of information. I mean, there's so much information that was even new from the last time that I had you with my support group. So that's fantastic. And there's some really great comments coming in. So what I'm going to do here is go through some of the comments and or some of the questions and see what you can offer for us. Okay.
Okay. Yeah.
And they're, yeah. So, in addition to there we go. Oh, hey, I got to figure out where I am here. There we go. I'd like to know more about aging with an MPN. Often I wonder if my fatigue is normal as I age, or is it the MPN? I've always been active now, but due to the fatigue, I really have to push myself.
Yeah, so great question. I think aging, even after, it's kind of interesting because aging, as soon as you turn the age of 30, all of our systems basically stop progressing and start regressing. And it's, you lose like 1% of every year of your collagen every year. And so you are going to start getting more fatigued as you get older. However, those individuals who stay physically active are going to have lower rates of fatigue. And so it's not necessarily so much related to aging, I would say. It's most likely related to your activity levels and how your body knows how to respond to those factors. Now, you do lose a percentage of your available max aerobic capacity after you turn the age of 30 each year. But that doesn't mean that you're not able to train your body still to improve that aerobic capacity and have less rates of fatigue. So I would say, hard to say without knowing you personally or knowing your MPN, but there's no reason why as you age, you couldn't keep working on that fatigue for sure and improving it.
Good to know. The next one here is, and I know you addressed about activity with low platelet counts. So this one is asking how about activity for high platelet count?
Yeah, I think that probably comes back to your risk of clotting and your concern about reducing your cardiovascular risk factors and making sure that you keep your blood flowing. And so increasing your blood flow is going to be great. However, if you are concerned, I'm not sure about a ceiling for high platelet counts, but as long as you're within that like higher normal range, I think it just goes to speak about how exercise is still going to be important in helping you reduce those risk factors and reduce your risk of clotting, and it's still going to have a great effect for you.
Okay. Just as a response to that first question there of the activity, the person has said that she's 25 and has had fatigue as well before exercising. So any response to that?
Yeah, I think it just goes to speak that, you can have fatigue at any age, and improving your exercise. Like I've talked about, fatigue is a huge barrier on our participation activities of daily living, and something that we can really change with exercise and starting to teach our body how we want to use it, and building our endurance and things is going to speak volumes even at any age to improving our fatigue.
Okay, thanks. The next one asks, can physical activity help with irregular bowels? So many of us, including myself, because we don't eat because of the nausea or the enlarged spleen, we don't have regular bowel movements and so forth. So can the exercise help with that?
Yeah, so I'm actually a pelvic floor physio as well. So bowel movements are something I talk to patients about lots. When you exercise, so at rest, you're in this rest and digest phase. And so your body and your parasympathetic nervous system is focusing on digesting that food and moving those bowels and regulating all those body systems. But when you start exercising, your body starts moving towards your sympathetic nervous system, which is going to work on evacuating and mobilizing your muscles and things like that. So it actually helps really get good stimulation to the bowels and moving things along. And it does actually tend to facilitate regular movements. Yeah, so it could help with that for sure, especially if you're dealing with some constipation. Exercise is great at getting your bowel moving and changing blood flow to your bowel to help with that.
Okay. This person has asked if you could demonstrate the lunge.
Yeah, of course. Yeah, lunges are great movements. I know almost every patient I give a lunge to, they groan at me because they are hard. I personally can work on my lunge technique. So let me just make sure you can see my legs here.
Yeah, you're good there.
Good. Okay. Okay. So you're going to start in just a split stance. And what I almost always recommend is if you're starting with a lunge, sometimes it's nicer to have something to hold on to. So I'm just going to put my chair there. Nice split stance, a little bit more. So you feel like a stretch in the back, in your back leg there. And what you want is just enough room to let that back leg come towards the ground here. So I'm bending both of my knees. So my hips are going to stay nice and stable. My shoulders are going to stay over my hips. Now, if you're starting with this movement, you can start by resting your knee on the floor here. What I would like you to do is start getting towards being able to just hover your knee and then stand back forward. But you're really just looking for that 90-90 bend in your knees and then coming back up. So you can start with that tap on the floor, pushing back up. Or you can go right just down to that hover. Yeah.
Okay, that's good. Thank you. So this person is asking about, what about ballroom dancing?
Oh, fantastic.
Yeah.
Yeah. Dancing is an incredible aerobic exercise for sure.
Okay. What about, or you mentioned aerobic and resistance exercise. Would you also recommend exercise for flexibility and balance?
Yeah. So balance is a fantastic practice of motor control. And so our balance, you're activating different muscle groups to maintain and control your center of mass. And so very similar to resistance training in that you're just going to be activating, maintaining that control of your body weight. And it's going to give you similar benefits for sure as resistance training. It's also super important in reducing our falls risk. Flexibility is incredible for your range of motion. Super important part in reducing tone in our muscles as well. Flexibility is often overlooked in programs for sure. But if we were going to think about a bicep curl, so if I'm doing a bicep curl, right, I'm going to get the best strength benefit out of my exercise by being able to contract over my whole range. Now, if my bicep was super tight and this was the only amount of range that I could get, right, I'm not going to be able to strengthen my muscles as great. So flexibility is important in just making sure you have available range of motion, and that's going to make you more effective in your resistance training for sure.
Just an aside comment on that. The flexibility part of my program was where I found out that I could not straighten my one arm. And that's where I realized that I would need elbow surgery because of a fall, because of other things going on with lack of muscle mass and so forth. So doing that, and when I was asked to straighten my arms, all of a sudden a new problem was there and we had to treat that. So, and that's where I am at this stage. So yeah, is a good thing to look at.
And so when you to speak to that, so when you get tight too in certain places, your body starts changing how you're using and firing muscle groups, which could lead to injuries as well. So flexibility is a great thing to check in with and just maintain during your program too.
Right. This person is that I started a weekly program of yoga, Zumba, and cardio musculation, but I feel a lot of cramps. I think that must be cramps during Zumba. More specifically, is that associated with medication or is it more with what I eat?
So it could be a few things. I don't think research has really determined a good answer. You know, lots of people like to hypothesize it's bananas. I've heard all my life growing up playing sports, if I had a cramp, oh, just eat more bananas. And so it tends to go back on whether it's like potentially potassium, it could be magnesium, but it could be medications for sure. That's not an unusual side effect of medications is muscle cramping, even muscle soreness. And it also could be dehydration. So if you're not intaking enough water, right, your muscles are going to be tighter and they can be more prone to cramping. And it could be nutrition as well. So like I said, sometimes they talk about potassium and magnesium. So it might just be a little bit of a nutrient deficiency in trying to mix in more fruits and vegetables to help just replenish that. Sometimes our muscles cramp just because they're trying to reset after exercise as well. You get lots of a release of chemicals in your muscle during an exercise to facilitate those contractions. And so there's a few different reasons, but I would talk to your physician potentially about your medication that you think might be causing it. And then if they think it's diet, you could try a nutritionist or just increasing your water and see how that goes for you as well.
We have one more question here and then some in the chats. Is brisk walking for 15 minutes, 3 to 4 days a week Carrying a moderately heavy bag, a good starting point.
Yeah. Yeah. So a moderate, so you're carrying weight. So that's fantastic. 15 minutes, 3 to 4 times a week for sure. That's a great starting point. You could start building on that, see how, if you could add another day, like I said in the recommendations, what they found was 3 times a week for 30 minutes. And so if we're looking at that, that's 90 minutes. So if you're just meeting 90 minutes over the course of your week, that would be a great goal to work up to, but fantastic place to start for sure.
Good. I know even when with me walking my dog, and I couldn't go very long, but as time increased, or as I got better with my cardio, then yeah, and she was much more happy. Are people with MPNs more likely to have more muscle soreness the next day than the general public? I'm relatively fit, used to run a lot, but have noticed extreme muscle soreness after exercise.
So I don't feel like I'm qualified to say MPN specifically. However, given what I understand, you totally could. Also, because of the way that your diagnosis is just going to affect you physically, it wouldn't surprise me if you're noticing more soreness than you were before your diagnosis, now that just things are changing in your body. Again, because you've always been fit, right? It's just that your body is now adapting to a different state of how it's working out. So there's a few questions I'd like to ask and follow up to that, but I think it wouldn't be without saying that an increase in muscle soreness might be expected for sure than before your diagnosis.
How can we move more when we have jobs that require us sitting 8 hours a day?
Yeah, desk work is very tough. And I think it just goes to that very simple changes, right? So you're sitting at your desk for 8 hours a day, 5 minutes an hour, or 5 minutes every few hours, or you take 15 minutes of your lunch break to do a little bit of movement, or if you can stand and answer some emails, that's fantastic. Lots of strategies I tell people who work in offices. I'm not sure if you're working from home, but get up and walk to fill your water bottle every hour, or when you are walking to the washroom or to fill your water bottle, you do an extra lap of the office. Going for a little walk at lunch or during one of your breaks is fantastic. And it's also going to make you a little more productive because it gets the blood flow going. I know when I was a student and I was sitting constantly in classes or studying, I would set a little timer on my phone and I would go walk my staircase 10 times just to help break up the sitting. So there's lots of different strategies, and sometimes it's just as easy as set a little timer, take a 2-3 minute break, movement activity break. You could even do some of those sit to stands I showed in the thing today, just to help break it up. But even just something like standing while you're reading an email or responding to emails is a fantastic place to start. Or taking the stairs up to the office, lots of ways. Yeah.
Good. What about exercise for people that have extreme bone pain in their feet?
Yeah, that's a hard one. And I think would be a great one to touch base with someone to assess you, just to make sure that you're not it is bone pain related to that and not something else. However, you can do lots of exercises with TheraBands sitting, and even just having a band and pushing your foot into it, if that was comfortable. You can do lots of leg lifts, laying on your back, lifting a leg, laying on a side, lifting a leg. So you can work out things that way for sure. Bands, lots of just different strategies. I would just look at more, or you could look up or seek information on just exercises that aren't standing so much, or getting a comfortable pair of shoes that are going to support your feet to reduce the sensitivity to your feet, to make you feel a little more protected against exacerbating that bone pain.
Yes, I was going to say, I know with myself, I did a lot of the bands because part of the reason was my arch in my right foot had collapsed, hence telling me I needed other things to happen. So to walk was extremely painful. And so that, yes, the ones with the bands were quite helpful. So
yeah,
I'm not sure here. I think we have all the questions in the chat and so forth answered. So if there's not anything else, I don't see anything. Oh, maybe one more.
I
Nope,
just
guess
I
that's
just
it.
see
So,
I just see this one about if she's doing regular workouts in the orange range and if she can
oh,
keep doing that. It
okay, I
helps
didn't see
me
that.
a lot with my mental health and decreased my symptoms, but my sleep needs increased a lot. So I'm not sure if that is a sign that I am doing too much. How do I know if I'm doing too much? Sleep needs increasing in response to how much energy you're burning. Definitely could be a sign that you're doing lots, but if it's something that's manageable for you, I wouldn't say if your symptoms are getting exacerbated that you need to stop doing it. So because you are living with an MPN, your body is probably just increasing how much sleep it's needing in order to help recuperate to that exercise demand on top of what it's already burning throughout the day. And so if you're doing regular workouts in the orange and you're feeling great and it's making you feel better, helping with those mental health for sure. The reason I started with the low intensity, that's just a basic good starting point for people who aren't regularly active right now. And so it's just progressively building. So if you progressed yourself up to this and you progressively worked yourself up to this intensity, fantastic. Anyone can do that who I talked like who's in here today. If you start low and you build yourself up to that orange range, you're more than welcome to do that. It's just that starting low is probably safer if you're starting from nothing. But if you're already in that orange range, you're not having an exacerbation of your symptoms, your body is just probably trying to get that extra rest over the night to make sure that it's recovering.
okay. Well, I can't thank you enough, Kimberly. It's been an eye-opening and informative session. And for those of you who belong to a support group, I, as a support group coordinator for Northern Alberta, have had Kimberly come to one of my group sessions, and then she was able to demonstrate some of this. It was quite, because we had a small group, quite interactive and able to ask questions and work through things. So if you belong to a support group, maybe ask your coordinator. And if you don't belong currently to a support group in our Canadian network, then maybe it's a good reason to join so that you could have access to people like her. I know that they do exist, not just here in Alberta, across Canada. So thank you so much. It's been quite a pleasure to have you this morning and this afternoon for our Eastern friends. And I hope to continue seeing you and using the exercises that have worked so well for myself. Thanks, Kim.
Yeah, thanks so much for having me, Patty. It was great. Yeah.
Great.
Thank you so much, Patty, for facilitating such a wonderful lecture from Kimberly. It was excellent, excellent. I learned so many new things that I think I'll try and incorporate in my daily life. So absolutely, thank you so very much. So we're on to our last part of our conference today, and this is a really exciting part. We're here to announce the Canadian MPN Champions Award. Each year we look at and put out nominations for you folks to nominate people who have given a lot of time, effort, and contributed to our MPN community. The Canadian MPN Network Champions Award is given to patients, care partners, medical individuals, donors, or patient groups that have contributed to improving the lives of Canadian MPN patients. This year, we are honoring 4 such individuals who have been nominated by our Canadian MPN Network community. So I'm very, very happy to and pleased to announce our 4 winners. They are in no particular order, but the first award winner is Dr. Percal from an MPN specialist in Montreal out of Jewish General and St. Mary's Hospital. Dr. Percal has been an MPN specialist for over 30 years and a hematologist at St. Mary's and Jewish General. So we're very, very happy to announce that he is one of our award winners this year. We also have another medical professional, Nurse Sabrina Folks, at the Jewish General Hospital in Montreal as well. And Sabrina has a multitude of talents and is really an added resource to the MPN clinic at Jewish General. And she has a very caring demeanor and really provides valuable assets to the physicians, and also a very caring and demonstrative participation with the patients that come to the MPN clinic at Jewish General. We're also very happy to announce Augusto dos Santos Legate, our MPN support group leader for our Quebec group. He is another award winner, and we are very, very happy to announce that he is now a MPN champion. And our last, but certainly not least, Canadian MPN champion is a longtime member of our community, and that is Marie Grenier Davis. She is a support group leader for MPN Ontario and has been a stalwart advocate for MPN patients here in Canada and also within the Ontario region. And we're very, very happy that she was nominated as an MPN champion this year. So congratulations to all of you and all the work that you do here for our Canadian MPN patients and our Canadian MPN community here in Canada. You will be presented with your awards personally, and those will be delivered to you by members of the Canadian MPN network in the upcoming months. So thank you. A round of applause for all of our Canadian MPN champions. And if you'd like to see a list of all of our previous MPN champions, please visit the Canadian MPN Network website so you can see a list of all of our Canadian MPN champions. So at this time, on behalf of Doug Chisholm and the Board of Directors, I would like to thank our committee, our conference committee, Joanne McKinley and her team, for putting together a wonderful conference today so that we could all learn a little bit more and learn, grow, and share together. I'd like to thank our sponsors for helping us put on this event today at Novartis. Thank you so very much to our friends at Novartis for sponsoring this event for us. And I'd like to thank the Canadian MPN Network Board of Directors for doing such a wonderful job in all that they do for the Canadian MPN community. Really, they work tirelessly and really have the best interests of Canadian patients and our caregivers and the entire community at the heart of all that they do. So thank you very much again to each and every one of you for attending our conference today. I hope you found Dr. Fleischman and Kimberly Dice's presentations of value to you. And really, it's important that we get your feedback from us. So you'll be asked before you leave the conference to do a short survey. And your feedback is very important and valuable to us as it helps us put together further conference information or speakers for us and helps us deliver better quality material for you as Canadian MPN patients and caregivers. So thank you very much again for your attendance today. I hope you found it valuable, and we certainly found your questions to be really of value to our speakers. And certainly watch for this. If you'd like to watch the entire webinar for in a few weeks, watch our website and our YouTube channel for a recorded version of today's events. So thank you very much again. Fill out the survey at https://forms, and it's listed on your chat, forms.gle. Please take a few moments to fill out the survey, and we would really appreciate that and find your feedback very valuable. So we'll give back a few moments of your day to you. It's 2:50 in the east, 12:50 in the west. So thank you once again for attending, and we wish you a wonderful and pleasant day. Stay warm and stay safe.